Well, hello everyone. My name is Melissa Washington. I am the CEO and founder of Women Veterans Alliance, and welcome you all to this very short discussion. And it's going to be very impactful with our presenters today, Dr. Kathy Cruz, National Lead Synchronous Telehealth VHA Office of Connected Care. We also have Christina Armstrong, a PhD Office of Connected Care. And we also have Dana Glenn, MD, Women's Health Medical Director, Tampa, VA. So again, welcome. I want to thank all of you for attending and being part of this day today. I really encourage you all to utilize the chat feature. If you have any questions or comments, please utilize the chat feature. That way we will get the questions and be able to answer those as well. So you are all here today for the VA and Women Veterans Alliance as we present Beyond Basics, Tools and Technology to Support Women Veterans. So this is going to be a Q&A discussion where I'm going to ask our lovely presenters questions, and they're going to share how their VA has different tools and resources and to empower you, the woman veteran. As you all hopefully know, today is a very special day for women veterans, as today is the 76th anniversary. Today is Women Veterans Recognition Day. Hopefully you've all seen that, whether on social media or in the news or at events that are taking place throughout the U.S., not only today, but all this week. So today is a very important day. We do have a link in the comments that will take you to a page where you can find out more about what Women Veterans Recognition Day is today. So again, thank you all for joining us today as we talk to Dr. Kathy Cruz, National Lead Synchronous Telehealth VHA Office of Connected Care. Whew, that's a lot to share, Dr. Cruz. We also have Dr. Christina Armstrong, Office of Connected Care, and Dr. Dana Glenn, Women's Health Medical Director, Tampa, VA. Welcome. So today, again, we're going to discuss how VA is using connected care tools to empower women veterans in their health journeys. And I think a really great way to start the conversation is by introducing our audience to what VA Office of Connected Care. Dr. Cruz, if you'd like to start us off.
I sure would. Thank you so much, Melissa. So connected care is really about the many ways that VA uses innovation to use technology through telehealth, through other connected care applications to empower veterans to take charge, to make the most of their health care. We expand the veteran experience from a traditional office visit to a larger clinical experience where we use technology. So what I mean by this is our telehealth technology, whether it's home telehealth, video telehealth, or our asynchronous applications, our VA mobile applications, and my HealtheVet, which is our secure messaging application, all with the idea of empowering our veterans to participate more actively in their care. What's interesting about it is when we look back over the data, like VA was really a leader in telehealth and in empowering veterans this way prior to the pandemic. And then through the pandemic, we saw the use of telehealth increase from 294,000 veterans in fiscal year 19 to 11.6 million last year. So it's been a huge increase and clearly speaking to the benefit of using technology with healthcare.
Well, excellent. Well, I'd love to dig more into some of the tools and mobile apps that can be especially helpful for our female veterans. Dr. Glenn, I'm going to come to you first for this question.
Yes, thank you so much, Melissa. And the more I hear about us talk about these great VA services and the impact it has, it really excites me because we all want women veterans to feel empowered in their healthcare journey. And sometimes the VA can seem like this huge, complex healthcare facility and can be a very large, confusing entity. But these apps really bring it all home. And there's a number of apps and tools that have been wonderful and in really helping women who have served our country, having the opportunities for us to serve them. So the mobile app store is where you can find all apps on any that are available on any smartphone or tablet. And there are dozens of apps to help veterans and their healthcare team better manage the number of health issues and overall wellness. And one of my favorite apps that I love to recommend is Caring for Women Veterans. Again, the name of that app is Caring for Women Veterans. And this app includes comprehensive information targeting specific healthcare needs of women veterans. And it also has facts and statistics about women veterans' health and gives an overview of the common issues that they face. And it really helps to guide that conversation about how to navigate through what's important in the healthcare decision. And then there's also HealtheVet. And this is where veterans can access their health record and engage with providers in a number of ways, like secure messaging, where an email can be sent any time of day, 2 a.m., 2 in the afternoon, tracking or setting up appointments, refilling prescriptions, and a whole lot more. And the VA telehealth services is leading the way in telehealth innovation to make sure that veterans have access to care when and where they need it. So this is really cool because veterans can meet with a VA provider virtually from their home or while at work or elsewhere that's really convenient for them, and also send important health data from where they are. With the use of a computer or a mobile device, it's really simple, but just having that connection to reliable, state-of-the-art, high-quality healthcare, that is so key. But the convenience and the portability issue is definitely a winner. And again, there are also opportunities where veterans can connect with specialists from across the country. So it may be a VA nearby or even one across the country. Also, there's a hospital telehealth where VA providers can collaborate to help with more complex VA care issues. So this is really exciting information, and I appreciate this opportunity to share it, Melissa.
Great. That's great. Thank you so much, Dr. Armstrong. While you were talking, I was going on to my mobile app to make sure that I have these apps as well. So thank you so much for that. So, Dr. Armstrong, I'd love to talk to you a little bit more about some of the other apps, which I'm going to go look as you talk about these as well, and tools you recommend, especially those to support mental health.
Oh, thank you so much. Yeah, so let's start with Mindfulness Coach. It's one of the absolute most popular apps that the VA has developed. It was developed by the VA's National Center for PTSD, who's responsible for developing many of those most well apps that we have. So the Mindfulness Coach was developed to help veterans, service members, and their family members and caregivers, and also staff members can use it too, how to practice mindfulness. So the app provides this gradual, self-guided training program designed to help you understand and adopt simple mindfulness practices. It's also fairly recently been completely redesigned, so it looks really beautiful. It has all these gamification elements that are really very engaging. And so as your practice in mindfulness grows, you'll actually see a tree, a mindfulness tree growing to kind of represent, visually represent your advancement in your mindfulness skills. Mindfulness Coach also offers a library of information about mindfulness and how it impacts our health. There's 12 different audio guided mindfulness exercises and a growing catalog of additional exercises available for free download. Again, these are developed by the federal government, so there's no cost. You're not going to get those pop-ups saying, "Hey, you want to sign up for premium?" No, there's none of that, right? So these are free, available to anybody, and they're fantastic. There's also a mindful mastery assessment to help you track your progress over time. There's customizable reminders, and also there's access to other support and crisis resources. So that's the first one I want to highlight. The second app I want to highlight is the PTSD Coach. Now, PTSD Coach, again, available on Apple and Android platforms, available from any of those to download for free. And it was the first app we developed actually in the VA. We developed it in collaboration with the Department of Defense. I was on the Department of Defense side at the time when this came out. So I remember how this was developed early on. And so again, developed by the National Center for PTSD, and the PTSD Coach app was designed for veterans, service members, and there's also a companion app called PTSD Family Coach. So if you are a family member or a caregiver of somebody with some symptoms associated with possible PTSD, it's a really good tool so you can help know how to support your loved one while, with whatever they may be struggling with. So PTSD Coach includes guided relaxation, exercises, soothing sounds, images, relationship tips, music, photos. You can really kind of customize it. And also, most importantly, it has really reliable, accurate, evidence-based information and approaches to PTSD, and also where to go to get help. It also has a standardized assessment in there, so that if you say, hey, you know what, I don't know if how my symptoms might compare, it's not going to provide any diagnosis at all, but it allows you to kind of check it out yourself. Say, hey, how are my symptoms? How are they changing over time? And then you can have a nice, informed conversation with the provider to have further discussions. So this app, so both of those, all of those are available on iOS and Android platforms. PTSD Coach also has an online version, to a web version as well. That's very nice. And so all of these apps were developed for veterans, service members, developed by the federal government, so are absolutely free, available for everybody. And Mindfulness Coach and PTSD Coach are, again, private. We can't see anything that you put in there, okay? And so that is really important for a lot of folks downloading this. As the VA, if you download the PTSD Coach, I can't see anything that you're putting in there. You can, if you choose to do so, export the data to your own email and then send it via secure message to your provider, but it is intentionally very safe, very secure, and free.
And fantastic. I was downloaded, and I noticed that also too, that I don't have to do a login or anything, and great information, something I'll definitely be using and sharing with others. So, all right, well, what I would love to do right now is to go around to everyone now and ask you a little bit about stories of how all this comes together to improve veteran health outcomes. What are some of your favorite examples of how you've seen this work in progress? So, Dr. Cruz, I'm going to start with you.
Okay, great, thanks, Melissa. So, I'm a physical medicine and rehab doc, and so I see a lot of veterans with musculoskeletal issues. And one of the things that strikes me is see a lot of young women patients who are struggling with the balancing between raising children, going to school, working, and trying to fit in their medical care and their appointments. So using the VA Video Connect to do video at home with them has been really such a great addition. One of the patients that comes to mind is a young, about a 30-year-old woman that I saw who had fibromyalgia and had started having low back pain. And she literally saw me carrying her baby. She couldn't, come to the medical center, but we did a VBC, and I was able to help her with some stretches and, show her how to use a heating pad, and then hook her up with physical therapy and chiropractic care, who talked to her about nutrition. And she called me afterwards and she said, if you hadn't seen me by video, I never could have had this appointment. There is no way I could have gotten a babysitter, or I would have taken my baby into the medical center. So the fact we were able to do this, it saved the day really for her and was able to get her the help she needed. So to me, that just kind of speaks volumes. And then we set up the rapport where she was able to call me and we communicate still.
Thank you, Dr. Cruz. What a great story. And I'm sure a lot of other women can relate, especially when it comes to childcare. Awesome. So, Dr. Armstrong.
Yes. So thank you for this opportunity. It's really interesting, not just for women veterans, just for all of us. One of the biggest questions that people have with their behavior, whether it's healthy or not healthy, is, hey, how is this really a problem? Like, for example, if there's drinking behavior, you say, hey, maybe you drink and maybe many other people drink. Sometimes it's hard to know at what point is it a problem. And, sometimes it's very scary to go to your healthcare provider and have those real conversations, right? We know that. And so a lot of these mobile apps, the huge benefit of them is that you can start to kind of track and see where you're at, and also get an idea of, well, how does this behavior compare to others? So, for example, with the use of alcohol, that's usually a topic that there's a lot of stigma around. It's very common in our culture, across many cultures. And so it can be very easily, maybe people are then using more than they want to, and maybe they're starting to see some like health outcomes that are concerning to them, right? So there's an app that the VA has created that called the Vet Change. And so in this app, anybody, but women veterans or anybody that wants to download this app, you can go and you can take a standardized screening measure that's in there. And again, nobody in the VA can see this. Okay, this is for you to kind of check for yourself. And you can go and you can put in, and you can be you can be very honest, right? Because only you are seeing the feedback. And then you can say, hey, this is really where I'm at. And then it'll say, hey, you know what? This is sort of typical, for your age and your weight. And, if you're a female, where you're at compared to other people of the same sex and age as you are. It gives you a nice comparison. Or it'll say, hey, you know what? Heads up, you're sort of in the concern zone, right? Or, hey, well, this kind of is a concern. It's not telling you what to do. It is just giving you guidance, right? And then you can then choose to either continue to track over time, which I recommend. It's fantastic. And you also choose when you're ready, right, to share that information with your provider to ask for next steps. So I highly recommend that. The first step in any behavior change is tracking what the behavior is already. And that's a really great way to do it.
Thank you so much, Dr. Armstrong. Dr. Glenn, we'd love to hear from you.
Yes. Hey, Melissa, I think this conversation resonates so much because we're listening to the voice of the woman veteran and adapting, adjusting, creating. And that's why I left private practice for 10 years in private practice to come to the VA, because I think about one of my big success stories was a virtual visit shortly after the pandemic, and a woman veteran in her 40s who was not new to the VA, but was new to Tampa VA. This was a new patient visit. We're going through some of the standard questions. Again, a virtual visit. I'm in the exam room at the clinic, cameras on, she's at home, camera on, and she starts to share with me her past experience about military sexual trauma. And Melissa, then she says, I've never told anyone about this. Now, grant you, she had been in the VA for many years, actually engaged in some care with mental health providers. But I was the first person that she ever disclosed this information to. So as she is talking with me, I'm wondering to myself, I've never met you, and yet you really disclosed this very personal part of your life that you've never shared with anyone. So I just keep listening. And she says, you know what, Dr. Glenn, it was the safety of the virtual room that made me feel comfortable with sharing this with you. And she was still going through some emotional pain, but she felt in control, and she felt that she could have a safe space to share, as I recall her explaining. And also she could end the conversation if she wished to with one click, that easy. And she felt like I was still listening. She could perceive that part of the conversation. That was a light bulb moment for me. And I got to tell you, in Tampa, and I know across the nation, we're seeing this theme where women veterans really are engaged with virtual care technology. One, convenience, ability to control the environment and the amount of care. You know, I want a lot of information versus I just want something quick and simple. But it also helps to facilitate an environment of trust and comfort. And it could happen even in the virtual realm. And that visit, I'll never forget.
Thank you, Dr. Glenn, for sharing that. That's so important for, especially for our women veterans, to have that feeling of comfort and trust, whether you're in person or virtual. And it's fantastic that the VA has opportunities for us to have our healthcare visits via telehealth. So last thing, before we get to questions, we've got to be real quick because we want to get to some questions, is I want you all to tell us more about how veterans can access, you know, these resources, because we've received a lot of resources, even things that are new to me, which I love. So Dr. Glenn, I'm going to go right back to you as far as sharing some of the resources.
Yeah, one of the things I think is hugely important, being enrolled in the VA is a great start, but I would encourage every woman veteran, please make an appointment with a women's health primary care provider team. And that team's going to work with you to help you in your healthcare journey. These are specially trained members of the staff that are really skilled and equipped and educated in the needs of women veterans. But there's other resources too. The Connected Care website is a great place for resources, www.connectedcare.va.gov. And also the Women Veterans Healthcare website, another excellent place for many resources, www.womenshealth, all one word, .va.gov. And lastly, the Women Veterans Call Center is an excellent resource, and you'll get a live person. They can help you with questions about benefits, eligibility, healthcare services. This is a phone number here, the 1-855-829-6636. And those are some great starting points.
Absolutely. Thank you. Thank you so much for sharing it. You know, there's so many resources out there for us, and they're there. We just need to know how to access them. So thank you for that. Dr. Armstrong.
Yes, ma'am. So all of the apps that we discussed today, from mindfulness coach to PTSD coach, PTSD family coach, vet change, all of these apps can be accessed directly, excuse me, through mobile.va.gov/app store. You can also go directly into the Apple App Store or the Google Play App Store on Android devices, and you can search for these as well. Just make sure it says, you know, VA or Department of Veterans Affairs before you download it, because sometimes there's apps out there that have similar sounding names, and you really do want to make sure that you're downloading the VA ones, because they really are safe, secure. The other thing that I would like to mention is that our team is putting those links in the chat. So please go to the chat as well, so you can be able to access those links too.
Thank you, Dr. Armstrong. And I also too wanted to share, again, I'm with Women Veterans Alliance. And if you're not familiar with the organization, please definitely visit our website at womenveteransalliance.com. So we've got a few minutes. So we're going to go to questions from the audience. And if you haven't already, go ahead and put your question in the chat. We'll get to as many as we can in the very short time. But I know there was so much information that was passed. So if you do have any additional questions, please let us know. And again, as Dr. Armstrong mentioned, there will be the links in the chat so you can find all these great resources. So a question we got from Stephanie. So this will be to you, Dr. Armstrong. Does the mindfulness app does it help with anxiety?
So mindfulness coach, so all of the apps that those apps that were developed by the VA are all built on evidence-based foundation. So what we do know from the research is mindfulness, practicing mindfulness exercises does decrease stress, right? And so of course, stress is associated with anxiety. And so the mindfulness coach app puts all of those best practices in mindfulness practice into the app. So it does, following these, it will result in decrease in stress. I wouldn't exactly say it mindfulness coach decreases anxiety, because it's really those best practices, even outside the app. If you use those practices outside the app, that will also decrease stress as well.
Fantastic. We got another question, which I think I may have the answer to, but you can correct me. Do you have to be enrolled in VA healthcare to use the mindfulness coach? And I don't think you do. I use VA for my healthcare, but I was able to download the app. So just making sure that I'm giving the correct information, Dr. Armstrong.
Absolutely. That is absolutely true. And this was intentional. So when we first put out the PTSD coach, that was the first app we put out. We intentionally created these. They're created for veterans and service members and their family members. However, we understand that it is not just folks in the military and veteran communities that suffer with these issues. And because these are all built on evidence-based practices, they are applicable to anybody. And so these are government-funded apps. And so why not let everybody be able to reap the rewards of these fantastic tools? So anybody can download them. And again, VA, we can't see what you do in there. It really is private.
And that's very important, especially when it comes to trust and knowing that it is private. Absolutely. So with all the telehealth tools, and this is a big question for all of you too, is do they work on all phones and tablets?
I can answer that one. And I'm going to get you more information to get you the most up-to-date information. There are 3 versions of what we do. There is the web version, which is internet, and then there is the iOS version, Apple, and Android version. But there are different versions. And so I want to say that I need to get more information as to all the different versions and what is available on each. We do definitely encourage the veterans to update to the latest version of whatever they're using so that they can have the most functionality. So it's kind of a complicated answer.
Thank you. All right. We got the last question in here. It says there are a lot of tools mentioned. What's the best one or place to start with? So I'll give each of you, tell us where you think the best one is to start with. So Dr. Glenn, I'll start with you. Where should someone go right now once they get off listening to us, get off the call?
Yeah, www.womenshealth.va.gov. But the tool Caring for Women Veterans gives a great overview.
All right, Dr. Armstrong.
Yes, I agree with Dr. Glenn. I will also plug connectedcare.va.gov. That allows you to route to whether it's telehealth, mobile and web apps, or any other route. So that's a really nice one-stop shop.
Awesome. And Dr. Cruz, we'll end with you.
Okay, well, I have to say that I definitely agree with my colleagues, Dr. Glenn and Dr. Armstrong, and I would suggest both of those to get the full picture of what's available. Thank you.
Fantastic. Well, that wraps up our quick 30 minutes with all of the fantastic tools that were shared. I want to thank you all 3 for your time. I want to also thank the VA for putting this together and giving me the opportunity to moderate such a great panel with great resources here on Women Veterans Recognition Day. So thank you all, and thank you all for watching.